Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Happy Tuesday. Welcome to our Tuesday show. Happy Tuesday, ATHLers. How are you guys doing? Hope all is well. I'm trying to do something a little different today, and I'm here standing up if my green screen behaves. That would be nice. Okay, so let me just make sure I am there. Okay, alrighty. Okay, so as you can see from the title, have you scheduled your annual physical examination yet? Okay, so I'm going to go in here because I have to be reading also. So I'm going to be looking this way. So, once again, my name is Abby Tyler. For those of you who don't know me, this is our second show of the year. So, I'm a family nurse practitioner. I work in a private practice, come with 22 years of RN nursing, and also I do some health fairs and all that, and I'm health contributor to Focus on Liberia, and also I do other things too. So for those of you who haven't joined forum yet, please click Abby Tyler's Healthy Living page and join, because in between the videos that I put on Tuesdays at 7 p.m. every Tuesday, 7 p.m. Eastern, I also post a lot of shorter videos during the week too. So I put a lot of helpful information. So if you haven't joined yet, please join. I know you're watching, you may be watching this from YouTube also, or in Focus on Liberia and other groups, but just kind of join so that way you don't miss other information in between. That'd be very valuable to you. So, without any further ado, once again, my name is Abby Tyler. I'm going to be talking about the reasons why you should get your annual physical. Okay, so I am a provider, but I'm not your provider. So, please do not make any changes to your regimen without first checking with your provider. Okay, I will be answering some questions in between. Alrighty, and if I don't get to your questions as I'm ignoring them, I'm just going through. Okay, so what's the reason you should get a physical? Now, most people might say, I don't need a physical. I feel fine. I'm moving around. I'm sleeping okay. I'm eating okay. Nothing feels different to me. So I don't need a physical. Okay. And so I don't want to go to physical because they're going to tell me something I don't want to hear. But actually, primary care, most of what we do physical is to also make sure we do screening and also to prevent other diseases. Most of what we do is screening and preventing, and then we take care of all the chronic diseases also, and also new diseases. But the most important thing is you want to see your primary care provider or doctor every year, once a year, and then also they will tell you how often they want you to come after your first visit. Okay, so if you don't have a primary care provider, you can look it up. If you were in a hospital, it will give you different options, and you can look in your information place or ask a family member if they live in the same area. Who would you recommend? Ask family and friends who are in the medical field. Who would you recommend for me to see to have a family care provider? Okay, so primary care provider. So most of the time it's like word of mouth, because somebody might say, "Oh, I go to this person and they're really good. Or I go to this person and they're really good." Okay, and you can change your provider anytime too if you don't have a good relationship with them. But I also talked about, making sure if you do have to change your provider, you changing them safely. Okay, so you're not in between medications and other things that you have to do. So, for the reasons for primary for your family, your annual physical examination, this examination, and also to go in your health history, preventive care, early detection of diseases, and also determine your risk factors. So, you said, what is involving when I come in to see my family doctor for my annual physical? For those of you who already been going through this, you still, even if you have other chronic illnesses, you still have to do a physical, because the physical, your annual physical, is also free. You don't have to pay any copay. Speak with your in health insurance. Okay, so that may be some discrepancy there or something there, but you don't have to pay a copay. And also, when you go see your annual for your GYN for women who are, going to gynecologists, also that's also your annual physical too. So you don't have to do a copay. But like I said, check with them first. Okay, but this is the time where if you go see your family doctor, that you're going to be spending at least 30 minutes with them. Okay, 25 to 30 minutes. And usually that's when you tell them everything about you, to sit down and listen to you and ask more information. It's a little bit more in depth than if you were going there saying you had like stomach pain or some problem. Okay, So let's start. So the first part, you go into the physical, you go in there to get you ready and everything. You go in there to see the doctor and your provider. You go in there. So the first thing we're going to do, we're going to be updating your allergies. So do you have any food allergies? Okay, because some people know, like, I have a drug allergy, I don't have a food allergy. Now there's sometimes you may be sensitive to something and it may not be a true allergy, or sometimes there are things where you eat. Let's say you eat seafood or like shrimp or something like that, and you get really bad rash and your throat start closing in and all. That's really serious. So because if you go for, you have to go for a CAT scan and they have to put a dye in you, like a liquid to put in your veins and all that too, so they can see the picture clearer. That can also have a problem because they also cover iodine. Iodine comes from seafood and all that, like the synthetic and all. So it's important that we, when we actually, do you have any food allergies? Do you have any drug allergies and all that too? You can say, okay, I don't remember exactly when I was younger, I took something. So it's important to, especially if you're a young adult, talk to your parents. Did I have any kind of allergy, and did I have any allergic reaction to anything when I was growing up? So can you please tell me that so I can have that? Because if you're not coming in with your pediatric records and all, that's something you need to find out from your parents. Okay. So be asking about that. Also, we'll go over your medications. If you take any medications at all, that means any medications that prescribed by other doctors, that means birth control pills, that means anything over the counter, any kind of herbal medications. I was just talking to somebody the other day. I say, we don't have anything against herbal medications. Like, I mean, I'm Liberian, so we do a lot of, we used to do street stroller, Julabo, Dundergrease, all those different other things. There's nothing wrong with that. We have a whole group of herbal thing, branch of medicine, like integrative medicine, and also like nutraceuticals. Okay, so you want, what if you go into your doctor's office, you want to tell them that, because I tell people the main reasons, it's not like to say we don't want you taking that, but you're not taking that in the prescribed amount. So the same amount you may be giving to an adult person to like give them something so they won't have diarrhea, it's the same amount you're probably going to be giving to a child. So that's where we, when we say, okay, we you didn't now, when most of the thing we give the children is like by their weight and all, and also by when you're talking to women who are pregnant, and so many other things that go into, like, when you prescribe a medication. So if you take anything that's natural medicine, you're not looking at the bigger picture. Okay, so if you're telling us, okay, I'm taking this, I'm taking something from work, and I also take care of patients who are from different countries as well, not just, So I say, okay, what medication you taking? Try to get like the natural fruit, the name of the medication you're taking, or natural stuff you're taking. Because if you say Julabo, I don't know what it comes from exactly. So because if you have any issues and you will be giving you Western medicine and it may interact with that, and if a medication that interacts with something that's natural, when you come to the hospital, we're going to be treating with Western medicine. So it's important that, okay, I'm taking Julabo, I'm taking this is the name of it, and then we can look it up and see what it is. Because if the medication you're taking doesn't have an antidote, meaning if I take this medicine and I'm having some reaction to it, I have to take another medicine that's going to stop that, that's going to keep me from dying. Okay, so it's always kind of good to kind of know the natural medication you're taking, the name of it, and have it written down. So when you do go to your doctor's office, we're going to go over your medicine. Also, it's called medication reconciliation. So we do that every time you go to the doctor's office. So it's important that when you go for your physical, we have that written down, and every time we have to do that to make sure. So when we send it, God forbid, if we have to send your records to the hospital, stuff like that, everything goes along, and they can say, okay, maybe this is what she took, maybe this is what he took, and all that. Okay, so it's important. So we get down all your medications. Make sure you have the list of all your medications, the dosage, how often you're supposed to take it, when you're not supposed to take it, and what you're taking it for. Because sometimes you could be taking medication for the same medication, it could be given for different other reasons. So it's important to know the diagnosis that you're taking the medication for. Okay, because some patients will come in and they say, oh, I'm taking this, and what are you taking it for? Oh, I don't know, my doctor told me to take it. Or I'm taking this high blood pressure medicine, or I'm taking this medicine. So the certain medication can go for different diagnoses. So it's important that you know why you're taking it. Okay, so always have it written down somewhere, or have it in a secret app on your phone, or have it written, because, and if you are going for your physical, bring all that thing. I also tell my patients to, if you're coming for your physical, or sometimes you're not aware what medications you're taking, please make sure to bring all your medications in your original bottle. Okay, don't bring anything. I mean, if you bring anything that creams and all that, to kind of wipe it off, or bring anything. Don't bring anything liquid that you've been rubbing all over your body. Of course, just have it written down somewhere. But bring it in so we can see it. But if you have a reaction to something, bring it in also so we know what it is. Okay. So, but bring all your medications in. We'll put it down. We'll compare it to what it says on the screen. We'll compare it to your last pharmacy list. Some people might bring in a pharmacy list, but that may not be, current either. Because what if you go to other pharmacy as well? What if you just have medications prescribed by another doctor? So it's important to bring all your medications in their original bottles. Okay. Again, like I said, you're going to be there for at least 20, to 30 minutes. So we have enough time to have it listed there. And sometimes the reason being also because people are taking medications that have that have expired, that sometimes off the market. Sometimes they added another medication and this other doctor didn't know, and sometimes they're taking duplicate medications. The pharmacy can usually catch it real quick, but if you go to two different pharmacies on something and they don't, click in between, that can be a problem, and that can be very detrimental to your health. So it's very important you bring your medications in and we go over it. Okay, we're going to talk about surgeries. Any surgeries that you had: wisdom tooth removal, cyst removal, breast, anytime with your breast, a lump, any kind of surgery. Make sure you know when you know what surgeries you had and when you had them. If you had like a colonoscopy where to check for colon cancer and all that too, we're going to ask you, when did they tell you? Did they find anything? Did they tell you when to come back? Because sometimes they'll tell you, okay, come back. We still saw precancerous growth, which is called polyp, and they want you to come back in 3 years. They want your frequency to be a little shorter. Come back in 3 years, and please go if they tell you that, because that means they see something that they want to keep a closer eye on. Or did they tell you to come back in 10 years? So at least that way you know where it's like, okay, they saw this, they were okay, and we went ahead and they said 10 years or 5 or 3 years. So make sure you find it out from them, because we get some of the records, but sometimes we don't get all the records. Okay, so the family doctor doesn't always get all the records, especially if you were in another state and all that. We can look it up pretty much all over, but sometimes we don't get everything when you come there. So it's important that we know that. So all your surgeries that you had before, okay? And then we're going to go over your family history here. Let me just do this for a second. Okay, like I also said, when you go to your family reunion, when you go to Christmas party or the holidays, it's always good to ask. You're gonna know what your mother and father's history and your siblings. Okay, and some of us come from cultures where we don't talk about it. Anything. This person in the hospital, what are they for? Oh, I don't know. And everything is like a stigma or a taboo. We don't want to talk about it because they may say, oh my God, I got cancer, and maybe I brought it on myself, or I got this and they brought it. And there's certain things that people don't know too much about yet, even though there's the information out there, but they go on Google or they go on WebMD and they get like more information that they needed to know, and they become scared. So they're like, okay, I don't want to talk to anybody about this because they may think that I brought this on myself, or there's something about me or whatever it is with my family. So I don't want to talk about it. But it's very important that you find out from your family. Do we have high blood pressure in the family? Do we have diabetes in the family? Do we have heart disease in the family? Kidney disease? Asthma, lung disease, all those other things that come on. Skin cancer. I know some people think that Black people cannot get, and I'm speaking to a wider audience, but I also know that, I also have for people who don't think that they can get skin cancer, is just relegated to one group. Like, people can get skin cancer too. That's why I always say, okay. And also, if you go to a family doctor, depending on the kind of practice that you go to, they might take off all your clothes. You leave your underwear on, of course, and have a robe on, and you look at your body from head to toe. Some other places won't take up anything. Usually my place, we don't take up everything. We just keep the clothes on, and I'll look over your body, and then I will ask you the parts of your body that I don't see. Are there any concerning lesions or moles or any kind of discoloration or anything that looks different? Is there anything that you want me to take a look at? Okay, and this is not the time to be embarrassed. Okay, I know it's hard. I know it's hard. With me, I go to the doctor's office too, and I know there are times where I'm like, oh, I don't want to do this. Okay, but don't be embarrassed. It's very important, because there's something that you may think that, okay, that's just a little mold that I had a while back, but it may have been growing. There's a little cyst there. There's something growth that is growing that we need to see, and we can send you to see the dermatologist, or keep an eye on it if it's just been something shorter period of time. Okay, so it's important. All right. So make sure you ask your family that. And then we're going to ask you about your social history as well. We're going to ask you, what kind of work you do. We're not passing judgment on the kind of work you do. It's just that sometimes if you come in and you're very stressed, or this work is making, you're having like you're straining your eyes, you're having severe headaches, it's making you dizzy or something else. So we can tell, your symptoms could be related to your work, or it could be something else. All right. So we check in with your work, and also how you handle stress. And do you work at nighttime? Are you getting enough sleep? Are you using more stress at the job that is causing you to maybe go into other activities that's not healthy, drinking, smoking, other things like that? Okay. So we check to make sure if you're smoking. That also, if you vaping also, most kids now thinking, oh, I would just vape, I don't smoke. And also you putting chemicals in your body that doesn't need to be there. Alcohol, some people might say, oh, I just drink occasionally, or some people you think that don't drink are the ones who are drinking, secretly. Maybe they're going through some kind of depression, they're going through some kind of anxiety, or maybe they just, and some people have the alcoholic gene in the family, that if I don't have it and I drink, I'm able to control my liquor. And there's some people that can't. So it's like, it's important that, okay, I just used to drink for a little bit, and now I find myself drinking a lot more. I was going through stuff and I just want to not think about it, so it makes me happier, and I just drink. And that's when you start getting into problems. So it's very important. We're asked about drugs and all that, marijuana, what is medical marijuana, we also need to know that. Or is street drugs, anything like any other things like that. If you're taking medication that's not prescribed to you, because most people say, oh yeah, my friend, I was having some problem, my friend gave me the medication. If it's not prescribed to you, please do not take it. Okay. If it's something that you say, okay, I was taking that and it was making me feel better for the symptoms that I'm having, and you come to see us, we can kind of go through that, go through your history and physical examination, all that too. So we may prescribe that medication, but also that based on your medical history, your family history, your allergies, and all that. Okay. And then also, why do you need to come to the physical? Because you can sit there again, like I said, you'll be having this conversation with your doctor. Okay. So for women, if you're young women, 21 years and older, I'm going to put something up about cervical cancer. If you're 21 years or older, you're supposed to be seeing your GYN, your gynecologist, the one that take a look at your female reproductive organs. Okay. So you're supposed to have a pap smear, because the most important thing, you want to ward off cervical cancer, regardless of if you're sexually active or not. You still need to see your gynecologist. Your first visit should be at age 21, unless something happened prior to that, where you're having some kind of symptoms and they needed to look. So they go in there and they take a look, okay, and make sure you're fine. And they send a specimen. Make sure, most people is the HPV virus, the human papilloma virus. Okay, most people can clear it out, and some people can't, and eventually that can lead to cancer. And if it's not taken care of, that can go up to into your womb, your uterus, and spread. And before you know it, you're looking at something more dangerous, and that can be life changing and also life ending. So it's important that you go, and your doctor will tell you come back every 3 years and every 5 years, or based on your history, your family history, or also based on your history and what they find, they might say come back more frequently. Okay. But that would be determined by them. So you're supposed to be seeing your GYN. If you're a woman, I'm going to be asking you if you're at maybe age 40, 45. I'll start talking about breast cancer. We're talking about that more before. But if you're a family member, if you have history of breast cancer, I did a show on breast cancer. Go back and watch that couple of shows down. Okay. So I'm going to be asking you, anybody in your family had breast cancer before? If you have family member, first degree, mother, aunt, sibling, that's you're a higher risk. Okay. It doesn't mean everybody's not at risk. You're at a higher risk. So we'll start talking a little and say, okay, when were they diagnosed? Now it's time to start having your mammogram. Okay. So we'll start doing that. Also at this age, men and women, we're going to be talking about colon cancer screening. Again, like I said, it's one of the diseases that like really asymptomatic, meaning you don't have any symptoms unless you start bleeding, start having issues with constipation, losing weight. So that's the most important thing too. When you also come to the for your physical, we do your height and we do your weight. Okay, so we're looking at the weight and we'll look at that. We'll be like, you gain a lot of weight this time. Is there something going on that could be tied to something else? Women, when they go into menopause, hormonal changes after childbirth, you naturally will gain weight. We also start looking at unintentional weight loss too, because that could be a signal of something serious going on. And we're actually, are you trying to lose the weight? If you are trying to lose the weight, are you losing healthy weight? You're not sitting there and you're starving yourself and going, 2 to 4, 6 pounds in one week, and you're taking something that's unhealthy, because that is also unhealthy for your heart and it's also unhealthy for your kidney. So we're going to be asking all those things too. And for women who are small framed, okay, we're going to be looking at your height, because making sure that you're not losing your body structure, your skeletal structure, and all. You may have to go for a DEXA scan when you're 65 to make sure your bones are strong. But if you had any kind of radiation treatment, kidney cancer, and all those different things, that also affects your bone as you get older. So we may not wait that long. We have to do it also. And men can also do that also. We can also do that, men. Okay. So, and also women at your age, which we'll be talking about menopause. And again, like I said, menopause is when you haven't had a period for 112 consecutive months. Okay. All of the things that come along with menopause. We'll be talking about that. And we'll also be sending you to a gynecologist who will be talking to you more. Some places have the gynecologist right there too. The family doctor also does this gynecological care. I'm also trained to see to do all of that too. So, but we don't do that at my place of work. we send you to the gynecologist. Okay. But I can also discuss that. We'll talk about domestic violence. We'll talk about childcare. We'll talk about if you're safe, like, oh, you're safe at home. All those things we talk about. And one thing I forgot to mention: if you want to bring somebody with you that you trust, okay, and the person can, keep your information safe. You want to bring them. Also, you want to bring somebody. Say, I'm nervous. I want to bring somebody with me that if I forget to say something, and sometimes write some of your questions down too, so that person can be there. If you're older, if you're somebody who don't understand English that well, if you understand English well enough, but you may not, you say, okay, maybe then I understand my accent, and I know I don't want to miss anything important. Bring somebody with you. As long as you say, we're going to ask you, okay, who is this person? Is this, are you giving me permission for this person to be here? And you say yes. We document that. Okay, because sometimes, and even some young people and their mother or their father would be there, and, "Oh, I want to talk to the doctor about something else." Okay, sir, can you step out? Or ma'am, can you step out? They don't have to be there simply because they're your parents. As long as you're over 18. And also, when you go into the pediatrician, there's certain issue that parents don't have to be there, because we have to ask certain questions without the parents there. Okay. And for women, if you're having domestic violence issues and all, there's a way we're going to ask the questions where if your husband is sitting there, that we can ask it where he's not sitting there. Okay. So it doesn't have to all happen that very day. All right. For men, we're going to be asking about your health history to your prostate. Anybody gets prostate cancer in your family? We may do a prostate exam while you're there too. Again, certain doctors' office don't do prostate exam. I'm also trained to do prostate exam, so I can do that already. We'll talk about, are you peeing? Oh, you get a certain age. Are you peeing? Okay. You urinating? Okay. Does it seem like it's burning when you urinate? Okay. It's like maybe like a short infection, or could be some kind of blockage going on there that your prostate is enlarged. We can talk about that. When you urinate, do you feel like you're emptying out completely? Does it feel like you pee more frequently? Also, we talk about weight gain around the stomach area. Also, that can increase like your risk for diabetes and all the other things. So we talk about all that. Okay. And family, like, again, if you're younger, for children, we talk about their for older people 18 and over. We talk about your immunization. Did you get your flu vaccine? Did you get the COVID vaccine? If you never got the first original ones, is there a reason why? Or did you have a reaction to the first one that you don't want to get the second one? So we talk about that. We talk about bullying also. We talk in childcare, in pediatric, we talk about puberty. I did videos on how to talk to your daughter and your son about their, going through puberty. Just look in my videos there. I did all that. Okay. And then we get to the point, we also talk about mental health. I talked about that, depression and anxiety. We talk about peer pressure. There's a lot of people, especially from different cultures, that would not discuss their mental health. And I wish it wasn't called, and people hear mental health and they hear mental illness. And they think, oh, all these people who are going around and shooting people, there's a whole umbrella, with mental health. You can be depressed today, maybe episodic, meaning you are going through something that you were depressed, and maybe you might need some medication just to help you out until you can go back to doing what you were doing before. It doesn't necessarily have to mean that. And then some people have clinical depression that you need to get here. Okay. And anxiety and other issues. Somebody died from you're grieving, and there's no one way to grieve, but there's also a healthy way to grieve. Okay. So we're actually about, when did you see the eye doctor recently? Did you see, and because you've seen the eye doctor, you want to make sure you don't have cataracts, you don't have glaucoma, January is also glaucoma month. Okay. And other things that come along, also be seeing the eye doctor, because they can also see other neurological issues too. Check to make sure you go to see the dentist, that you don't have inflamed gums, anything that affects your gums, and also have some overall health. Okay. So we're gonna be asking when the last time you saw the dentist. You're supposed to be seeing the dentist at least twice a year. All right. And then more frequently if you have issues. All right. And we'll ask for all your different, also see if you have diabetes, making sure you're going to go see the podiatry every year, the foot doctor every year, to make sure your circulation is okay, that you don't have any wounds that you can see. Are you checking your feet every day? Make sure you're not walking around barefoot if you have diabetes. So if you cut yourself, you may not know, because especially if it's advanced, then chances are more than likely your circulation is a little poor. And next thing you know, that little cut that may heal on the regular person's foot may go all the way up. And then next thing you know, you're talking about, severe wounds and infection, and all that may lead you to losing your legs or stuff like that. So it's important. Okay. So we talk about all that. If you have any other issues that go, any other chronic illness, have you follow up with your, with these other doctors? Did you see the heart doctor? You have other issues. If you had a stroke before, if you had a heart attack before, if you had stomach issues before, if you had kidney issues before, are you following up with all your other specialists that you're supposed to be following up with? I may ask you, okay, you saw the kidney doctor, they did your blood work. work, especially with kidney disease. Most of the time, you don't know there's anything going on with your kidneys until your kidneys like completely, like almost like 75% destroyed. Okay. And so you want to make sure you're getting your blood work. And when you come to us, we'll be doing the, blood work too. We're going to be checking your CBC, which is a complete blood count. We're checking for infection. We're checking for anemia, especially if you're a woman, if you see your period, you may be a heavy bleeder too, that maybe you may be anemic, that we may have to put you on some medication for a while. We're doing your BMP, that your basic metabolic profile or the complete one. We're checking your kidney levels. We're checking your electrolytes, your sodium, your potassium, all of that, all of the chemicals that control your heart, that control your body. We're checking your liver. We're also going to be checking for your A1, your liver enzymes, your numbers there. We're checking for your A1C, which is the number that tells us whether you're diabetic, that measures your blood sugar over a 3-month period. We're going to be checking for that. We started adding a little bit more to different things like your hepatitis screening. We're going to be checking for your cholesterol level. Most of the times you don't know you have high cholesterol until you start having problems, and then your blood pressure also. We're checking all of that. Okay, your heart rate. Then I some places like they'll do EKG. Like you say, you have to do an EKG now. They're asking, I think age 21, baseline EKG. If we feel the need to do that, and also depends on your practice, we can do that. And also depends on your symptoms and medical history. So the most important thing, we'll discuss all that, and we talk about modifying and modifiables. Okay, in this world, we live in a social media world where everything is like what you see, and everybody wants to look good. And we talk about skin issues and all that too. I know people talk about acne, and it's like, oh my God, this one is this and all that. Acne is not just because you're dirty. Acne is an actual medical diagnosis. Okay. Some people have like really bad acne that they need to see the dermatologist for. They may be following the primary care doctor for medications. And if it doesn't resolve, or if it's not well controlled, then you have to go see the dermatologist, and you may have to be put on like long-term antibiotics and other things. Okay. So some people are blessed with good skin from the day they're born, and some people have acne all through adulthood. I used to have acne for the longest time. Sometimes I break out of people here and there. It's like, it is what it is. Some people are blessed with this, and some people are that have that, whatever, blessed, cursed, whatever it is, as long as you go in to go see your family doctor. Okay. And we talk about peer pressure again. All right. You see the pretty people on Facebook, you see the pretty people on different Instagram and TikTok and all that, and so many things. Don't let all that carry you away. You just have to do the best that you can. Okay. And then you have to get to the point where you're saying, I know I'm not going to be that person. I'm not going to be this 6'2" or 5'9" and 110%, or maybe I am. Those people also have issues too. Okay. So just be comfortable who you are. And it takes a while. It takes a while. Nobody's going to get to the point where it's like, oh my God, I'm just gorgeous, nothing wrong with me, and I'm just, and all that. Even, so accept who you are. You have to get to that point where you have to accept yourself for who you are, and then work with what you got. Because guess what? You're sitting there and you're thinking, oh my God, I'm this and this. And somebody else is sitting somewhere and saying, I wish I looked like that. I wish I had all of that. Okay. So again, modify the modifiables, meaning making you can get your blood pressure down, you can get your heart rate down, you can get your weight down, depending on your medical history and all. If you don't have thyroid issues and other things that's causing you to gain weight, work can also help you gain weight. The kind of work I do is like I spend most of my time when I see my patients, and then I'm charting, and I come home and I'm charting and all. So, and some people do like flying or different things where they're not really active and all. So making sure you find time to do that 30 minutes a day, 3 times a week or more, if you can tolerate it, making sure you check with your doctor first. Okay. So the most important thing, modify the modifiables. You cannot change your genetics. You cannot change meaning your family history and all of that. Doesn't mean because somebody had diabetes in your family, you're going to have diabetes. It just means that you have a higher risk of getting it. So you have to work yourself so you don't get that. Okay. Breast cancer, colon cancer, all those other things that may be genetically related, some autoimmune diseases also. So you want to make sure that you're following your doctors frequently, do your annual physical, and then frequently after that. Okay. Or they tell you to do. And then we'll do your physical examination. Okay. So that's when I would check you from your head to toe, checking to make sure we don't see anything there, doing your eyes, looking in your mouth there, looking at your throat, making sure we don't see anything that's concerning. We'll be listening to your heart, listening to your lungs, and all. That's why when you see the doctor at the stethoscope, listen to your heart rate, making sure it's not, and then also to the rhythm, that it's not irregular, that would signal something more dangerous going on. We're looking at your veins, your carotid veins over here, because they don't want any blockage here that may lead anything to your brain, that may cause the heart attack, that may cause a stroke. Okay, we're actually, if you're sleeping well, how are you sleeping? Are you snoring? Making sure you don't have sleep apnea, looking at your belly. Sometimes we may measure it and all. I know some people, like again, childbirth and all that, and dad belly, mom belly, as long as not to where it's like really severely large to where we start getting concerned. Again, like I said, when there's too much fat in that area, that can cause other issues too. Okay, we'll watch and see how well you walk, making sure you're not limping, making sure, and like your back is on, but actually bend over, making sure your back is straight, because sometimes when you have back pain, that can also affect the way you walk also. Okay, so we're checking all that. And there's sometimes people, so I don't want to make this too long, but there are sometimes people don't want to go to the doctors because for legitimate reasons. I don't want to go to the doctor because some people come and they're overweight and they say, I don't want you taking my weight. And we might say, why not? I don't want you taking my weight yet, because there's some people who had eating disorders that don't want to discuss that, or they feel ashamed or whatever way. And what people say things to them. I've talked about that before over here. So and they'd be like, okay, but there's sometimes where some medications will based on your weight and other things, and we're looking at severe weight gain if it's unhealthy, and severe weight loss. So we're looking at that too, because you can go from one extreme to the next. Okay, so we talk about that. And some people are like, I don't want to go there because they're going to tell me something I don't want to hear. And what if they do a test and I find something? But it's the most important thing is you want to go get tested. You want to get your blood work done, because what if they find something? It could be the beginning stages. Again, determining your risk factors and also early detection. Okay, so you may say, okay, I don't want to. What if they find out at this? What if you go there and you just, I see your blood pressure? I may say, oh, your blood pressure is a little high right now. We're going to check it again next month. Okay, or come back in 3 months. Or we may have to change some of the medications around, because you maybe have been taking this blood pressure medicine for over a year now, and your blood pressure is still high. Okay, so we might want to do that. It could be something coming from your kidneys. We might want to do more testing. So, and sometimes we do more testing and we find something else, and people are like, oh my goodness, what if they find something else? Or they may say something else, they go looking for something, or they'll find, to try to find something just to justify getting paid. No, it's also called incidental findings, because it's like we're looking for something else and we see something more serious, or even it may not be something more serious, but something that needs to be addressed. We're going to have to address it, because eventually it may cause a problem. So you want to get that scared. And trust me, I do. Whenever I'm going for my mammogram every year, I'm like, oh, I dread going, but I want to I want to find out. Okay, and then when I leave from there and I go to I go shopping. That it makes me, that's the way I make myself feel good. I go shopping, I get my results, and I go shopping, and I'm like, okay, I'm fine. So, and most of the things, get a friend, be like, did you get your physical yet? Did you get your Call your friend, call your close family friends, call your family members. Did you get your physical yet? Okay, have a friend go with you, make it like a thing. We all gonna get our physical today. Okay, and then we're all gonna go get, if you're women, we're all gonna get our GYN examination, do everything like in 1 week. Okay, I know people work, and sometimes you can schedule everything the same time, and sometimes it's difficult to have all the doctors, but just say, I'm gonna get all my testing done in February, especially for insurance too, because you want to get all your deductible out of the way. I'm gonna get all my stuff done in January, I'm gonna get all my stuff done in February, and I'm gonna get that over, and I'm gonna exercise, and I'm gonna eat healthy, and I'm gonna do the best that I can. Okay, but it's very important that you get your physical done, because again, early detection, determine your risk factors, your family stuff, review your medications, review your vital signs, your allergies, and everything else. Okay, so it's important, because the most important thing we want to do is to prevent anything that may happen later, or delay it, or start addressing it now. Okay, so it's very important, but that's the time you're going to be there for, at least, like I said, 20 to 30 minutes with your provider, and you want to sit there and have an honest conversation. And there are some things that I did not mention, and you might want to sit there and talk about it. Okay, and maybe you might need a note from your doctor saying, I can't do this job anymore. I need to do something else because this is causing me problem. You can also talk about marriage stuff too. We send you to go see, if you need to see a mental health provider, like a counselor, you can go to a counselor, and so many other things. There's so many other resources out there that you can tap into when you see your family provider too. So it's not just going there and saying, okay, they're just going to do this and then check me out and give me and then I go about my merry way. No, that's the time where, like, again, like I said, it's free. if you have insurance and all, and some places do a fee for service, so it's not that expensive. And you sit in there and you just talk it over, and you have to renew your medications. And and sometimes it may be the only time you go to see your doctor the entire year, because if you think you're healthy, you may not want to go, especially those who are younger. But go there, establish a relationship with your doctor, get to know the person, the office, get to know the office staff, get to so you don't want to come there when you're like, oh my god, my stomach's hurting, I need to go see my doctor. And then the first time you'd be like, I don't like that person, I don't like the way they were doing, I don't. Let's establish it, and then sometimes you'd be like, maybe I don't want to, or if you change your insurance, a lot of people had to change their insurance recently, and you have a new doctor now. So it's the best time to go and meet that doctor, see the office, if it's conducive to you, if you like the people there. And don't say, okay, I was there one time and then that's it. Okay, sometimes you can go there and you think people didn't like you or whatever the reasons were. Also, if you want to get a doctor, if you say, okay, I'm more partial to female doctors, I'm more partial to male doctors, I'm more partial to somebody who understands my language or understands my background, you can also make the decision to do that. It's not, as long as you're not saying when somebody else walks in, and let's say you go to a practice that have other people, and then somebody else walks in and you don't give them a chance to like introduce themselves or to get to know you and to get to know about you, because there'll be times where you may not have somebody who in your neighborhood or close by that really. Also for GYN too, some people don't like to have male GYNs. It's important to call ahead and say, do you have a female GYN there? So I don't want to see a male GYN, and that's totally legit. Totally legit. You don't, some people don't have any problems. Like I said, I didn't have any issues with having, my GYN as a male. He turned out to be my preceptor. So yeah, okay. So it's important, alrighty. And I think I've gone way over, but this is my Tuesday show. So, and this is a longer show because it's the physical. Again, you'll be spending a longer time with your doctor with that. So I don't see any questions there. I'm sure, I hope I didn't talk too fast. I was trying to get this under 30 minutes. Let me see here. I can't believe I had this. Didn't I wear my glasses? Okay, so Morris said, is that Morris? Morris said, hi. Let me see here. Oscar Freeman, I'm watching you from Liberia. Oro Sinkar, Monrovia. I used to live where Tudman, is it Tudman High? We used to live behind Tudman High way back in the day. So if that's where you live, hi, my Sinker person. And there was a school there, I think it was C. Cecil Dennis School way back then. It's like went there for like the first year or so. Okay. And so hi, my Sinker neighbor. And Stanley Thomas saying say he's watching. Thank you. So thank you to everybody who tuned in. We're also doing the 21 days of consecration, like I discussed. If anybody needs to know about that, there's a couple of videos down where you're abstaining from anything that brings you that's negative in your life. So for 21 days, and 21 days is always also when you lose it's like to kind of break an addiction. So they say 21 days is when you can break an addiction. So make sure you're doing that. And also, again, like I said, doing some self-reflection, doing some introspection. If you're a praying person, pray, try to get good vibes for 2023. Okay, and just make sure things that are like not good for you, try to stay away from them. If it means like social media addiction, and sometimes you don't necessarily have to stay away from social media, especially not from Abby Tyler's Healthy Living, but just the kind of people you interact with. Because I see myself sometimes when I'm on there and I want to write a comment and I'm going, oh, I know if I'm not just writing to this person, I'm also writing to everybody else who has commented on this page. So I don't want to get involved in that, and I'll stay away from it. Okay, so you can try to do that, and other things that are not good for you also. Alrighty. So I don't see any more questions. And again, like I said, if you're watching from Focus on Liberia or YouTube or anywhere else, I usually put a lot of helpful videos on during the week. Okay, a lot of health information. So consider joining Abby Tyler's Healthy Living page and join the group and join us in this journey of health and wellness. Okay, so and just hit follow, and also like. Okay, and please, guys, please give me a thumbs up for this video. Tell me what I did right. Tell me I did wrong. If it's any kind of criticism, I'm open to any kind of criticism. Like I said, this is how I make myself better, by listening to people. And because of the kind of job that I'm in, I have to listen to my clients too. I'm not just coming to you guys like I know everything. I learn from you guys, and also in the field of medicine and all that, we have to do continual education. So I try to make sure that I'm up to date with all my information that I bring into you guys. Okay, so thank you all for watching. Alrighty. And please share the show. Please share the show. I'm going to share it to the other places before. So please share the show. And I will see you guys next Tuesday at 7 p.m. And again, I'll be putting up more videos. Okay. My Abby's Daily's Dose, I'll be putting that up like every other day or so. So hang in there, 21 days, 21-day challenge. And I will see you guys at next week at 7 p.m. Thanks. And I'll talk to you guys later. Bye-bye.